Hi, my name is Dola Abiodun, and this is my psychopharmacology case presentation. Lithium. This medication is best known as a mood stabilizer for treating mood disorders such as bipolar disorder. It controls symptoms of mania and prevents the reoccurrence of mania and depressive episodes. The specific biochemical mechanism of action is not known. However, upon taking lithium, it becomes widely distributed in the central nervous system by interacting with neurotransmitters and receptors, decreasing norepinephrine release and increasing serotonin synthesis. My first case presentation. Malvin is a 35 years old Caucasian and is a busy supervisor at a local fast food chain when he had started having problems. He would go days without sleeping. He began having problems at work, getting irritated and intolerant of his subordinate for the past 3 months, and he sometimes misses work. He spent all his life savings buying things he really does not need at home. His best friend convinced him to come in for an evaluation. Mali felt he was just stressed at work, leading to him making poor decisions. His family members felt things are not the same because he has always been a quiet and thoughtful person in the past. The patient's thought process was delusional and stated he has been having recurring thoughts of suicide for over 3 months. He denies the use of any current medication, past psychiatric history, or meds, substance abuse or use. Medical history is non-drug allergy, family history of psychiatric, medical addiction, developmental and social history. The mini mental status examination done revealed the score of 27. Diagnostic tests ordered were blood chemistry, CBC, thyroid panel, urine drug test was done, and MRI was also ordered. His physical examination shows a poor grooming and hygiene male that appears his stated age, poor eye contact and appears restless. His speech was slow and mood was depressive. All other physical findings were within normal limits. Differential diagnosis includes substance use and abuse, schizophrenia, and major depressive disorder. After thorough evaluation, he was diagnosed with bipolar 2 disorder. The DSM-5 bipolar 2 disorder consists of depressive and manic episodes, which alternate and are typically less severe and does not inhibit function. Criteria have been met for at least one hypomanic episode and at least one major depressive disorder. And ICD-10 code is F31.81. Treatment plan: Marvin was prescribed lithium. He was referred to start short-term psychosocial interventions such as CBT. This was very helpful for him and he was able to return to work full-time. The second case is Anne. Anne is a 22-year-old Hispanic female that is a final year civil engineering college student when she started when she started developing problems concentrating at school and passing her courses. She was dating and having sexual relationship with three different men. She will go on for days without sleeping. She sometimes goes days without any personal hygiene, stays in the room without attending lectures, nor cleaning up after herself. Her college roommate had problems with her about her hygiene. They decided to alert the school authorities who called her parents about this problem. Her parents immediately brought her in for consultation to her primary care doctor who referred her to the mental health specialist. At a primary care doctor's office, they ran a pregnancy test due to her stating she cannot remember her last menstrual cycle and found her to be pregnant. At the mental health clinic, Anne's main complaint was feeling overwhelmed with her school workload, leading to her trying to stay away to catch up on it. She says she sometimes has feelings of being sad, loss of interest, and sometimes she has racing thoughts that keeps her awake for nights. Her parents say she has been a very smart and intelligent child, a type A personality that always wants things done to perfection. They could not believe this was happening to their only child and admits to having history of hypothyroidism diagnosed 2 years ago. However, currently not adhering to her med. She denies any past psychiatric history, taking any psychiatric medication, substance use, or allergies. Her father admits to family history of bipolar disorder, hypothyroidism, and breast cancer present in her grandmother. They deny any addiction history in the family. She denies any developmental history, denies any smoking, vaping, alcohol, or illicit drug use. Diagnostic test was ordered: blood chemistry, thyroid panel, CBC, ACG for her pregnancy, and mental status examination conducted with a score of 26. Our physical examination finding shows an obese female with a spontaneous speech and euphoric mood, otherwise normal physical examination. Differential diagnosis is substance abuse, schizoaffective disorder, hypothyroidism, major depressive disorder, generalized anxiety disorder. Diagnosis: bipolar disorder with DSM-5 For a diagnosis of bipolar 1 disorder, it is necessary to meet the criteria for a manic episode. The manic episode may have been preceded by and may be followed by hypomanic or or major depressive disorders episodes. And ICD-10 code is F31.1. Treatment plan, the treatment plan. Other mood disorders or atypical psychotropic med, such as Abilify, will be chosen, not lithium, for this patient. Evidence-based non-pharmacological intervention that will be recommended is CBT and family-focused therapy. Appropriateness of approach. The lithium, for the case study one, lithium is an option for the long-term treatment of bipolar disorder because it reduces the risk of reoccurrence and improves symptoms of the disorder. It is appropriate for this patient due to his suicidal ideation. Extensive evidence and treatment guidelines generally support the use of lithium as a monotherapy or in combination with other agents as an option for treating bipolar in appropriate patients. The World Federation of Societies of Biological Psychiatry guideline give lithium and other antipsychotics their highest recommendation grade for the long-term treatment of bipolar disorder. The case 2, the reason lithium was not utilized as an effective option for this patient is because it is associated with adverse effects of hypothyroidism, fetal and neonatal harm, and weight gain. Since this patient's TSH is not within limit and she's overweight and obese, lithium is not a good choice of medication. It is noted that thyroid function is decreased in less than 20% of patients and may cause goiters in 30 to 55% of patients. Also, lithium is contraindicated in this patient because she is pregnant, finding support the risk of relapse during pregnancy, and the use of this medication is associated with risks to the fetus. Overall encounter and family teaching. The case 1, adequate teaching of the illness, treatment, and social support is known to help treatment compliance with lithium. Overall, this patient most likely will be compliant with his treatment plan due to the strong family support. He is an asset and he has had no hard times making goals and meeting deadlines in the past as a supervisor. The patient will be made aware of the narrow therapeutic index of lithium and how follow-ups are important for blood levels draw while on the medication every 3 months after obtaining a steady blood level. The case 2, overall, Anne is a liability due to her pregnant situation and she needs all the support to get through this period. Patient will be referred to a support group to help her strive and cope. The culture and diversity. In a study performed at Kakoli, Ugoli, and Ugoli in 2013, absence of emotional support has been associated with poor response to lithium therapy. In a culture where treatment is often borne by patients' entire family, there's an increase in compliance with lithium therapy. In conclusion, lithium is a psychotropic medication that has been around for several years and it is effective for the treatment of bipolar disorder. However, it has a narrow therapeutic index. The therapeutic index is between 0.4 to 0.8, and it needs to be used discreetly with patients, especially the non-compliant. I learned that lithium has unique evidence of anti-suicide effects. Secondly, there are contraindications for lithium such as untreated hypothyroidism, pregnancy, and renal failure. Thirdly, the DSM-5 criteria of bipolar disorder and differential diagnosis were all things that I learned. Thank you. These are my references, and thank you.